liver cancer. Unveiling its causes, symptoms, and treatments. Liver cancer is a life-threatening illness, ranking among the rapidly proliferating types of cancer in the world, especially in the United States. This condition poses a significant risk to life and is characterized by the abnormal and uncontrolled growth of cells within the liver. Today's video, we will cover information on liver cancer, including its causes, symptoms, types, and treatments. Before we begin, make sure to subscribe to the Cancer News TV channel and give this video a thumbs up. The liver continuously filters blood that circulates through the body, converting nutrients and drugs absorbed from the digestive tract into ready-to-use chemicals. Liver performs many other important functions, such as removing toxins and other chemical waste products from the blood and readying them for excretion. Because all the blood in the body must pass through it, the liver is unusually accessible to cancer cells traveling in the bloodstream. The liver can be affected by primary liver cancer, which arises in the liver, or by cancer which forms in other parts of the body and then spreads to the liver. Primary liver cancer, which starts in the liver, accounts for about 2% of cancers in the U.S., but up to half of all cancers in some undeveloped countries. This is mainly due to the prevalence of hepatitis, caused by contagious viruses that predisposes a person to liver cancer. In the U.S., primary liver cancer strikes twice as many men as women, at an average age of 67. Because the liver is made up of several different types of cells, several types of tumors can form there. Some of these are benign, non-cancerous, and some are cancerous and can spread to other parts of the body, metastasize. These tumors have different causes and are treated differently. The outlook for health or recovery depends on what type of tumor you have. Not only this, primary liver cancer are of different types like hepatocellular carcinoma, HCC, or hepatoma, is the most common type of primary liver cancer, and it starts in the main cell type in the liver. The hepatocyte cholangiocarcinoma, or bile duct cancer, starts in the cells lining the bile ducts, which connect the liver to the bowel and gallbladder. Angiosarcoma, which starts in the blood vessels. This is a rare type of liver cancer that is more likely to occur in people over 70. As of primary liver cancer, hepatocellular carcinoma tends to occur in livers damaged by birth defects, alcohol abuse, or chronic infection, with diseases such as hepatitis B and C, hemochromatosis, a hereditary disease associated with too much iron in the liver, and cirrhosis. More than half of all people diagnosed with primary liver cancer have cirrhosis, a scarring condition of the liver commonly caused by alcohol abuse. Hepatitis B and C and hemochromatosis can cause permanent damage and liver failure. Liver cancer may also be linked to obesity and fatty liver disease. Various cancer-causing substances are associated with primary liver cancer, including certain herbicides and chemicals such as vinyl chloride and arsenic. Smoking, especially if you abuse alcohol as well, also increases risk. Aflatoxins, cancer-causing substances made by a type of plant mold, have also been implicated. Aflatoxins can contaminate wheat, peanuts, rice, corn, and soybeans. These are rare problems in most developed countries like the U.S. Other causes include the hormones androgen and estrogen and a dye formerly used in medical tests called thorotrast, anabolic steroid use, male hormones abused by athletes to increase muscle, can slightly increase liver cancer risk with long-term use. Researchers have suggested a link between diabetes and liver cancer. This is likely due to the link between diabetes and fatty liver disease. Inherited metabolic diseases, diseases that disrupt the normal metabolism of the body, have been shown to increase your risk of liver cancer. Rare diseases. Researchers have found a link between liver cancer and some rare diseases, like alpha-1 antitrypsin deficiency, tyrosinemia, and Wilson's disease. Secondary cancer in the liver is cancer that started in another part of the body but has spread to the liver, If you have secondary cancer in the liver, it may be useful to read information about the primary cancer in conjunction with this information or about cancer of unknown primary. A secondary cancer is named after the primary site where it began, for example, bowel cancer with liver secondaries. In this video, we use the term secondary cancer in the liver to refer to any cancer type that has spread to the liver. It is estimated that more than 3,000 people were diagnosed with liver cancer in 2023. The average age at diagnosis is 69 years old. Because the liver is made up of several different types of cells, several types of tumors can form there. Some of these are benign, non-cancerous, and some are cancerous and can spread to other parts of the body, metastasize. These tumors have different causes and are treated differently. The outlook for health or recovery depends on what type of tumor you have. The more common benign tumors of the liver include hemangioma, hepatic adenoma, focal nodular hyperplasia, cysts, lipoma, fibroma, and leiomyoma. None of these tumors are treated like liver cancer. They may need to be removed surgically if they cause pain or bleeding. Symptoms of liver cancer, which you need to know. Liver cancer happens when something affects healthy liver cells' DNA. DNA carries the genes that tell our cells how to function. We all have genes that tell cells when to grow, multiply, and die. For example, oncogenes help cells grow and divide. Other genes, called tumor suppressor genes, monitor cell activity, keeping cells from multiplying uncontrollably and making sure cells die when they're supposed to die. When our DNA mutates or changes, our cells get new instructions. In HCC, DNA changes turn on oncogenes and/or turn off tumor suppressor genes. For example, studies show cirrhosis related to hepatitis B virus, HBV, and hepatitis C virus, HCV, account for more than half of all HCC cases. When these viruses infect liver cells, they change cell DNA, turning healthy liver cells into cancerous cells. Liver cancer symptoms are more likely to appear as the cancer grows or becomes advanced, like weakness and tiredness, pain in the abdomen, swelling of the abdomen due to a buildup of fluid, ascites, pain in the right shoulder, appetite loss and feeling sick, weight loss, yellowing of the skin and eyes, jaundice, pale bowel motions, fever. Upon observing the symptoms, one may wonder about the diagnostic methods employed by healthcare providers for liver cancer. If your healthcare provider identifies signs and symptoms indicative of liver cancer during a physical examination, they may initiate various tests to gather more information. Blood tests, such as a liver function test, can assess liver enzymes, proteins, and other substances to determine the liver's health. Additionally, testing for alpha-fetoprotein, AFP, may be conducted, with elevated levels suggesting the presence of liver cancer. Ultrasound is utilized to obtain images of soft tissue structures, specifically to detect liver tumors. A computed tomography, CT scan, which captures detailed X-ray images, provides information about the size and location of liver tumors. Magnetic resonance imaging, MRI, produces clear body images using magnetism, radio waves, and a computer. An angiogram is employed to examine the blood vessels in the liver, involving the injection of dye into an artery to monitor vessel activity and identify blockages. To confirm a liver cancer diagnosis, healthcare providers often resort to biopsies, where they extract liver tissue to scrutinize for cancer signs. Additional tests may be conducted if intrahepatic cholangiocarcinoma, IHC, is suspected. Endoscopic retrograde cholangiopancreatography, ERCP, utilizes an endoscope and catheter to inspect bile ducts, while percutaneous transhepatic cholangiography, PTC, creates X-rays of bile ducts similar to ERCP. However, PTC involves delivering contrast dye via a needle directly into bile ducts and the liver, typically for individuals unable to undergo ERCP. What are liver cancer stages? Healthcare providers stage HCC using standards set by the Barcelona Clinic Liver Cancer System, BCLC. This system evaluates HCC liver on characteristics, including whether your liver is working well, tumor size, and your symptoms. Healthcare providers may use different terms for each BCLC stage, sometimes presented as being stages I to IV or 0C, or by terms such as early and advanced stage, HCC. Hepatocellular carcinoma has 4 stages. Stage I, very early stage, stage 0. You have a single tumor in your liver that measures less than 2 centimeters, cm. Blood tests show your bilirubin level is normal. Stage 2, early stage, stage A. You have a single tumor that measures 5 centimeters or less, or you have more than one tumor that measures less than 3 centimeters. The tumor may have spread to your blood vessels. Stage 3, intermediate stage, stage B. In this stage, you may have more than one tumor, and/or a tumor that measures more than 5 centimeters. The tumor may have spread to your lymph nodes, large blood vessels, or another organ. Stage 4, advanced stage, stage C. The cancer has spread to other places in your body, such as your lungs or bones, as well as lymph nodes. Now let's explore the standard treatments for liver cancer, particularly those commonly implemented for secondary liver cancer. Surgery can involve removing part of the liver or a liver transplant, where the whole liver is replaced by a donor liver. Surgery is suitable for a small number of people with liver cancer, and it will depend on the size, number, and position of the tumors. Surgery to remove part of the liver is called a partial hepatectomy. Following surgery, the remaining part of the liver can usually repair itself if it is not damaged and grow back to normal size over a few months. If there are tumors in both sides of the liver, surgery may be conducted over 2 stages to allow the liver to regrow following the first operation. For some people, it is not possible to remove part of the liver, and they may be considered for a transplant. A number of factors are considered before someone is eligible for a liver transplant, including the person's overall health. In addition, a person should not smoke or take illegal drugs and should have stopped drinking alcohol for at least 6 months. A liver transplantation may be possible. However, waiting for a suitable donor liver may take a long time. During this time, most people have other treatment to control the cancer. Tumor ablation. Tumor ablation is used most commonly for small primary liver cancers. It is rarely used for secondary cancer in the liver. The most common types of tumor ablation treatments use radio waves and microwaves to heat and destroy cancer cells. This treatment is administered by either a needle inserted through the skin, percutaneous ablation, or a surgical cut, ablation with surgery. Less common types of ablation treatment include alcohol injection, where pure alcohol is inserted into the tumor to destroy cancer cells, and cryotherapy, which is surgery that freezes and kills cancer cells. Chemotherapy. Depending on the type of liver cancer you have, you may receive chemotherapy drugs to kill, shrink, or slow the growth of the tumors. Chemotherapy can be given systemically, via tablets, or intravenously through a drip, which means it goes throughout the whole body. This may be given other treatment, such as surgery or cryotherapy, to get rid of any remaining cancer cells. It is not usually used to treat primary liver cancer unless the cancer has spread to other parts of the body. Systemic chemotherapy can also be used as palliative treatment to slow down the cancer growth and reduce pain. Chemotherapy can also be given directly into the tumor, which is called chemoembolization, or TACE. As it is targeting the tumor directly, stronger drugs can be used. TACE is more commonly used for primary liver cancer. Biological therapy. A range of treatments that work against the cancer cells by either stopping their growth or function, or by helping the body's immune system destroy them. Used for both primary and secondary cancers in the liver, it can be used in conjunction with or after other treatments for cancer. Selective internal radiation therapy. Also known as radioembolization, this treatment targets liver tumors directly with high doses of internal radiation in tiny beads. It is used for both primary and secondary cancers in the liver when the tumors can't be removed with surgery. It is not available in all areas. Endoscopic stent placement. If the cancer in the liver has obstructed the bile duct and bile has then built up in the liver, it may be recommended that a stent, thin tube, is placed in your liver to drain the bile and ease symptoms. We hope you get some major information about this life-threatening disease. Don't forget to like and subscribe the channel. See you in next video.